We have actually been working with the EMSC program since its inception. We've been working very cooperatively and collaboratively with the EMSC program. In fact, most of the national activities that we do are not only in collaboration, but are co-sponsored and co-funded by the EMSC program. Many of the projects that we work on are tied in with EMS for Children's activities. Again, very cooperatively with the program, but we have worked collaboratively on the EMS Agenda 2050 project, the recently completed EMS Scope of Practice model revision. We're just starting to now work on an update of the EMS educational standards. We work very closely together on state assessment programs and a number of various programs that impact the evolution of EMS systems around the country. Well, I think over the next year, a couple of the projects that are particularly interesting to us and will be applicable to the pediatrics population are an update project on the field trauma triage guidelines. We'll be working on an update project of the EMS crash analysis activities. The National EMS Quality Alliance is a relatively new project that's working very aggressively at developing EMS performance measures. The pediatric community is very well represented on that, with Dr. Kathleen Brown as one of the co-chairs of the Measures Development Committee. One of the things that we worked with the program on over the last year was the Critical Crossroads Toolkit development process. And we found that there wasn't a lot that was specifically applicable to that as it relates to pre-hospital component, because there wasn't a lot of research that allows us to look at the issue very closely. We've got to pay attention to that and really focus on the mental health needs of the pediatric population, how EMS can help address that, and can be involved in getting the patients to the appropriate resources. We're looking forward to continuing the very collaborative relationship that we have had historically and have really been expanding on over the last several years. One of the things that we're hoping for is to be able to take more advantage of data and information that's available in the National EMS Information System and the National EMS Database to look more closely at pediatric issues. Well, we've all talked about research and data issues. There's a lot going on right now focusing on clinical care activities, including the pediatric population, and the development of clinical care guidelines. We've really got to continue our focus on that and base those on appropriate evidence as we continue our research to develop that evidence. We have really appreciated the engagement and the relationship that we've had with the EMSC program. The federal staff are just jewels to be able to work with, working with folks at the Innovation Center and a lot of the EMSC representatives in the state. It is fun to see their passion and to be able to capitalize on that.